It's good to see you again. It's really appreciated that you've given us some time to come and talk about you fixing hearts. For those people that don't know you, so enough of my hero worship. If you could just introduce yourself so people know who you are, what you do, and why you're doing carnivore, I suppose.
Sure thing. I am a heart surgeon over here in the States. Been a heart surgeon now for 20 years, done over 3,000 heart surgeries. And during much of that time, I was a very unhealthy heart surgeon. I had reached a point where I was morbidly obese, I was pre diabetic, and I realized that I was going to end up on my own operating table, so to speak. And I was at a loss of what to do because I was following the advice that I had been educated to give my patients, the advice that we've all heard: eat less, move more, count your calories, eat a low fat diet. And it wasn't working for me, and it wasn't working for my patients. And thankfully, I started to come across different information, started to ask some different questions. My journey really started, first with Gary Taubes and the case against sugar and why we get fat. And I gradually eliminated sugar from my diet and then carbohydrates. And then I reached a point, probably about 3 or 4 years into that journey. I had lost a lot of weight, was feeling, much better, was really in the best shape of my life. And I heard about the carnivore diet. And I heard about the carnivore diet first from Sean Baker. And, honestly, at first, I was like, that sounds kind of crazy to eat only meat. But then when I really thought about it, I wasn't eating a whole lot in addition to meat. I was eating a little bit of veg, here and there. I was eating some nuts. And I said, let me give it a try. I've opened myself up to new approaches, and I've been open to new ideas around health. And I started eating a carnivore diet. This is now about 4+ years ago. And I noticed some additional improvements over my very low carbohydrate diet. For me, it was really some persistent inflammation. I had some plantar fasciitis in my foot, my right foot, that I could not get rid of. And my third day on carnivore, I remember getting out of bed, and for the first time in years, my foot didn't hurt first thing in the morning, and it really didn't come back again. And so, as I looked more and more into the false information around meat and heart health, and have just become a very big fan of the carnivore diet as one of the approaches that I now recommend to my patients to help them avoid the need for heart surgery and stay off my operating table. And while I continue to work as a heart surgeon, I have been increasingly focused on helping people to not need heart surgery. And that's what I've been doing for myself and for my patients now for the past 4 years or so.
And I must say, I mean, you're reverse aging because the last time I spoke to you, you genuinely, it's not flannel to thank you for being here. You definitely look younger than when I first spoke to you. And it is amazing. So I'm going to ask you $1 million question. We have got some questions lined up, but I think when you've got a cardiac expert, someone that's had people on the operating table, and we're talking carnivore, and Rich, oh, by the way, we're into our 20th hour. We've done 20 hours. So well done. You've got here on the 20th hour, which is 4 to go. We can't wait. Saturated fat and its relation to heart disease. As an expert in cardiac issues, what is your take on saturated fat and all that cholesterol and how it clogs your arteries?
Yeah, so my take now, and this isn't only my take, this is what a rigorous evaluation of the scientific literature shows us, is that dietary cholesterol and dietary saturated fat have absolutely no relationship to heart disease. And the the science, I'll put it in quotes, that led us to believe that has been thoroughly disproven now. There have been multiple studies, meta-analyses. We can look at the randomized controlled trials around this, and we see that the diet heart hypothesis, the hypothesis that the fat that we eat, specifically the cholesterol and the saturated fat that we eat, then increases our, alters our blood lipids, and most commonly, it is thought to increase our LDL cholesterol. And that increased LDL cholesterol then leads to heart disease. Both parts of those hypotheses, I think, have now been thoroughly disproven. And, what I have now witnessed more and more with the patients that I've worked on is that the more that they eat meat, and I'll also say the more that they, along with that, eliminate processed food, the better their heart health gets. And I am seeing people who are now able to stop the progression of their heart disease. I have seen people that have shown some reversal of heart disease on things like coronary artery calcium scores, lowering those scores. And, I see people with that have already suffered heart damage that have actually increased and improved their heart function when they go on whole real food diets, I think is the first thing. Low carbohydrate, low sugar, elimination of things like vegetable and seed oils. And the carnivore diet is a great way to accomplish that. I think it's the easiest way to accomplish that. And that's why, I've stuck with it. I don't think it's the only way, quite honestly. I don't tell all my patients you need to be on a carnivore diet, but I think it's a great tool to achieve those things that are important. Like I said, the elimination of processed food, the elimination of sugar and highly processed carbohydrates, and the elimination of vegetable and seed oils.
Yeah, I think that's a big one, isn't it? The seed oils. So I just heard you say about the coronary artery calcium scan. You've seen some people lower it. Was there any special protocol to do that, or was it just the carnivore diet that you put those people on?
Yeah, so it's like I said, a whole real food diet that eliminates processed food and all those things that we mentioned. And for many, that is a carnivore diet. Some of them choose to keep small amounts of non-processed foods like vegetables and stuff in their diets. And then there are some other things that probably help with that. When we look at we can point to something like vitamin K2 that seems to be helpful in regulating the calcification process and minimizing, calcium in our blood vessel walls where we don't want it. And of course, vitamin K2 is only available in animal products. Sure, you can supplement it, but I don't think that's as good as getting it from your food. And so, again, that's another reason that I point to a carnivore diet as perhaps uniquely beneficial. I think you certainly want to incorporate lots of animal protein, lots of animal foods in your diet if your goal is to reverse calcification so that you're getting large amounts of dietary vitamin K2.
What type of, what's the best foods for K2? Is it pork?
Well,
is
it's really going to be things like, all sorts of ruminant animal meats. Heart is actually going to be high in that as well. But it's, it's pretty ubiquitous in animal proteins. So whatever animal protein you want to eat, you're going to get a good amount of vitamin K2.
I think Richard's chomping at the bit to ask a question.
No, fire away. No, I'm just, I mean, we went through a quick presentation, didn't we, on cholesterol. So yeah, I'm enjoying listening to this bouncing back, to be honest. It's all good stuff. I'm coming back to what you said about K2. I mean, it's, kale in the UK is stamped with a stamp that says high in vitamin K, but it doesn't actually contain any active form of vitamin K because it contains vitamin K1. And as you rightly say, we need to consume vitamin K2, which we can only get from animal proteins. And it seems to be the case with every other vitamin and mineral that we look at in high quantities when it comes to vitamin A, B vitamins, particularly cobalamin, vitamin B12, pyridoxine, vitamin B6, and the rest of the nutrients that we need, creatine, carnosine, carnitine, taurine, choline, all of these things we find in animal proteins, not from fruits and vegetables, which is what we've been led to believe, for the last 70 plus years, isn't it? We're told to consume our 5 fruit and veg a day. But what happens if you consume that volume of fruit and veg? Then you're full and there's no room for the meat. So the one thing that's actually healing and repairing your body is no longer being consumed. We're consuming these foods, these cereals, which are grains, which cause glycation. And then these seed oils, which cause oxidative stress. And in my opinion, the glycation and oxidative stress are the 2 main drivers of cardiovascular disease. They cause damage to the ApoB100 receptor, which it leads that LDL particle floating in the bloodstream, finds its way into the subendothelial space, engulfed by the macrophages, grows into the foam cell, because the macrophages have that scavenger receptor which recognizes that damaged ApoB100 receptor. So it comes back to this carbohydrate or glycation from carbohydrate, particularly from grains, and the oxidation from the seed oils. The 2 things that we are told to consume to be fit and healthy. We're told to consume our whole grains and avoid our saturated fats and replace these for vegetable oils. It's a joke when you take a step back and look at it. The 2 things that we are told to consume to be heart healthy are the 2 main driving factors of cardiovascular disease.
Yeah, it really is. And, you brought up a couple of important points there. One being that in order for cholesterol to get trapped, within our blood vessel walls and start to build up in plaque, it needs to be damaged cholesterol. So that is, I think, a big problem with the way we view cholesterol in medicine today. The general approach is just lower cholesterol, and it's not focused on the types of cholesterol that we have. And, that if your cholesterol is not damaged, it's not going to cause a problem. And the second thing you pointed out is you also need to damage your blood vessel walls. And the things that damage our blood vessel walls are things like high blood glucose, which comes from eating a lot of carbohydrates, that glycation process that you've talked about, that damages the endothelium, the lining of the blood vessel. The vegetable and seed oils, can also cause damage to the blood vessel walls and cause inflammation, which contributes to this process. Things like smoking, of course, we know, which is a risk factor for heart disease, and things like high blood pressure. And again, at the root cause of high blood pressure is typically insulin resistance, which goes back to eating lots of carbohydrates and these processed foods. So everything leads you back to these processed foods that, ironically, as you also mentioned, were introduced into our food supply to try and combat the heart disease problem. And the reality is that they've made it worse. And this is what I have, was seeing once I kind of had my eyes open to it, that we have been fighting this battle against heart disease here in the United States, especially for the past 70 years. And we've been focused on the diet heart hypothesis during that time. We made changes to the food that we eat. And then we introduced medications targeting this problem. And it has not had a noticeable impact on heart disease. Heart disease remains far and away the #1 killer here in the US and worldwide, in the UK certainly as well. And, we need to step back and say, how can this be? If we've made all of these changes, if we know that patients' LDL cholesterol levels are lower than they've ever been, if more and more are on these medications to lower their LDL cholesterol, and we're consuming less red meat and less saturated fat than we ever had, then how can those be the cause of heart disease, which is not improving? So those are, the high level evidence that I like to point to. And yeah, we can get into all the nitty gritty about all the things we were just talking about, and the different apo particles, and whether they're damaged or not, and the endothelium and all of that. But I just like to point to the high level evidence. That if we look historically, we ate a lot more red meat than we do today, and heart disease was not a problem. We have been eating red meat for our entire existence as human beings, and heart disease was not a problem until the past 150 years or so, when we started to introduce these other processed foods, when we started to consume large amounts of sugar, when vegetable and seed oils were introduced into our food supply.
Did you want to follow up, Richard, or do you want me to carry on?
Carry on. Love that. Yeah, it's fantastic. It's brilliant to just to speak to an expert. I mean, we look at these studies and clinical trials, and we do have experts here in the UK. But I mean, it's just fantastic to have a soundboard just to bounce that back to, isn't it? Because I think some points you think that you're absolutely mental sometimes when you tell people that saturated fats are essential for life and cholesterol is essential for life. So no, I'm thoroughly enjoying this. Please continue.
Yeah. So if you've got your lipid panel, then Dr. Philip, what would you be looking at? What would you think is the most important indicator or indicators of heart health or problems?
Yeah, so the two numbers that I think are most important to look at on your basic lipid panel, which is the test that you're most likely to get from your physician, are going to be your triglycerides and your HDL cholesterol level. And specifically, you can look at the ratio between those two. Now, important for your audience is that ratio should be done in the US unit. So you need to convert your millimoles over to milligrams per deciliter before you do that ratio calculation. And you want to divide your triglycerides by your HDL cholesterol. And ideally, you want that number to be less than 1.5. Less than 2 is pretty good, but you really want it to be less than 1.5. And when you look at those two numbers, those give you an indication. It's an indirect indicator of whether or not you're insulin sensitive. Ideally, I like to measure insulin levels and measure directly whether people are insulin sensitive. I like to get the advanced lipid panels, the NMR panel, that's going to show you the size of your particles and is going to tell you whether or not you have damaged LDL cholesterol particles or not. The small, dense ones are the ones that we don't want. Those are the damaged ones that get into plaques. The large, fluffy LDL particles, those are the ones that are beneficial to us. And so that's why just looking at the LDL, like most doctors, most GPs will stop at just looking at the LDL. And the LDL is not informative to us because it's not telling us what type of LDL particles that we have. And if you have a lot of large, fluffy particles around, you're going to be just fine. Even if you have a smallish amount of small, dense particles, in other words, you have a low total LDL, and I oftentimes see this in people who are on medications, they'll have a low LDL, but the vast majority of their LDL particles are small, dense LDL particles, and those people are still likely to end up with heart disease. Those are the people that I see ending up on my operating table every day.
There's another theory, isn't there, about atherosclerotic plaques being formed by thrombus or something, isn't there?
Yeah, certainly Dr. Malcolm Kendrick has written extensively and spoken extensively about this. And I think that blood clotting is an important part of the process. It turns out that, the same processes that damage your LDL particles are the same processes that cause you to be more prone to blood clotting, things like inflammation and insulin resistance. I would say it's a little hard to separate those two, but I think paying attention to blood clotting factors is another important part of this puzzle. And, the blood clotting part of it can explain a lot of the things that don't get explained well by the cholesterol hypothesis. Things like why patients that have low cholesterol, low LDL cholesterol levels, still end up with heart disease.
Yeah, thanks for that. I was just looking at a question. I was going through a line, but I'll just put a question in. I think this is for you. What's your opinion of the importance of the LPIR score?
Yes, I'm a big fan of the LPIR score. And for those of you who aren't familiar with it, it's lipoprotein insulin resistance. It's one way for us to assess whether or not patients are insulin resistant. And the LPIR score is a score that's derived from the size of your cholesterol particles. So it actually looks at more than your LDL particles. It also looks at the size of your HDL particles as well as your VLDL particles. So it looks at a bunch of different particles, and it uses that as a predictor of whether or not you're insulin resistant. It's sort of working backwards because we know that insulin resistance is what is influencing the size of your particles. It may not be the ideal test for insulin resistance, but it's one of the best tests we have. When we go back to the gold standard test, which is Kraft testing, looking at your insulin and your glucose response over about a 3-hour period after you take in a glucose solution, Kraft testing can be very impractical to do. You have to to do it right, you have to do 6 or 8 blood draws over a 3-hour period. Very, intensive test to do. So the LPIR score, I find, is probably one of the best surrogate markers we have of insulin resistance. And I use it on my patients frequently. Not sure how available it is over in the UK, but certainly here in the US, we can get it done.
Yeah, it's not that common here. We had a question earlier, but it was much, much earlier before you were on, which is a very basic one. If you have aFib, is it still okay to do the carnivore diet?
Yeah, certainly still okay to do it. And again, may be very beneficial. I've now worked with a number of patients who have aFib, so atrial fibrillation, which is an irregular heartbeat. It emanates from the top chambers of the heart, the atria. And what I have seen is, before I get to how the carnivore diet can affect aFib, understand that aFib is oftentimes rooted in inflammation. It's inflammation that seems to occur within the electrical system of the heart. And one of the great benefits of a carnivore diet is lowering of inflammation. So what I have now observed in patients with aFib that do the carnivore diet is oftentimes their aFib will get better. Now, may not reverse it completely. A lot of that depends on how long you've been in atrial fibrillation, how advanced your atrial fibrillation is, in terms of, are you in it all the time or are you only in it sometimes? But I've seen a number of patients now who have improved their atrial fibrillation, again, when they eliminate processed food, eliminate vegetable and seed oils through a carnivore diet.
Yeah, so just actually to go to a bit more basic then, because we've talked about seed oils ever such a lot. What's the mechanism that seed oils, why are seed oils problematic?
Well, there are probably a number of pathways that they cause their problem through. So omega-6 fatty acids, and specifically linoleic acid seems to be the worst actor here, is pro-inflammatory. So one of the things that the vegetable and seed oils do is they basically concentrate omega-6. They deliver omega-6 in much higher amounts than we have ever consumed as human beings. And this can be a little confusing to people because omega-6s are actually essential. They're considered an essential fatty acid, meaning our bodies can't make it, and you do need to get some from food. But traditionally, those were very low amounts. And when we introduced vegetable and seed oils, what that did was that that delivers a large amount of linoleic acid and omega-6s, which are pro-inflammatory. Our body can't process these properly. So, but our body, they're close enough to the other fatty acids, things like omega-3 fatty acids, that our body does incorporate them into things like our cell walls. But because they're what we call polyunsaturated. So, we talked about saturated fats, and what that means, the structure of the fatty acid is such that all of the bonds are saturated, and there's no place for that fat to get oxidized, for oxygen to join in and start that oxidation process, which again is another way that these fats get damaged. Polyunsaturated, meaning that they have multiple places that are unsaturated, are very prone to oxidative damage. Oxidation is something that's always going on within our bodies. We try and keep the levels lower. But it turns out when you introduce a combination of polyunsaturated fats with high sugar, and this is what almost all processed foods are, that's a very dangerous combination, because now you've introduced these unstable fats into your body, and then you're giving the fuel for the oxidative process to increase. And this causes inflammation throughout the body. It causes mitochondrial dysfunction. So the actual powerhouses, the power plants of our cells can't use these fatty acids the same way that they use other fatty acids. And this all leads to insulin resistance ultimately, which then leads to all those downstream effects that we've already talked about.
Thank you for that. So I'm going to ask a personal question. I'm not asking for a doctor-patient relationship, but just to make it a bit real. I had my coronary artery calcium scan at age 50. I'm 59 now, and it was 639, not the world's worst. The cardiologist at the time said, "Don't worry, I've seen some in 1,000." Then my wife walked in and she got a big fat 0. So anyway, what would you be allowed to recommend a carnivore diet to me if I was a patient? This is hypothetical, or is there a duty of care where that would not even be spoken of?
No, I feel very comfortable recommending carnivore diets to patients such as yourself, because again, what caused that damage? And we can look at, there are various things, but from a dietary standpoint, it's pretty clear that processed food, all the things we've been talking about, is what leads to that damage. So telling you to eliminate that food, I have no problem doing that. I have seen no convincing evidence that eating red meat leads to that problem. Eating red meat in isolation leads to that problem. So I am very comfortable recommending a carnivore diet. Sometimes when I'm talking to my colleagues, I'll phrase it as a whole real food diet, and they'll be like, "Oh, that's great. Whole real food. Everyone should be eating that." And I'm like, "Okay, well, what if if we then say we're only going to eat animal whole real foods?" And then they'll get all, kind of flustered by that. But the reality is that, I have now seen many patients who have taken that approach, and they stabilize their coronary artery calcium scores. Their calcium scores don't get worse. And that's really my goal with patients like yourself, who have elevated coronary artery calcium scores, but it hasn't progressed to the point where they have, where they're having symptoms or we think they're at imminent risk of a heart attack. And so our goal is, okay, let's try and stop it from getting worse. And I think the first step there is elimination of processed food. And again, like I said, a carnivore diet can be a great tool. And I've now worked with many patients with that approach. And it's working very well, I'll say.
Brilliant. What is your view of a theory that LDL, for instance, isn't actually high when it's over like 200? It's where it should be, and normally, because people have plant sterols, it's artificially low. So in fact, when they say it's high, it's actually normal. Can you speak to that?
Yeah, well, like I said, I think looking at the amount of cholesterol is the wrong thing to be looking at. We really need to be focused on the type of cholesterol that you have. So we can look at the studies and we can see that, there seems to be a kind of U-shaped curve when you look at, total cholesterol levels or LDL cholesterol levels, and too low is certainly problematic and increases mortality. There's a little bit of an increase as you get too high. But again, that's probably picking up the people with familial hypercholesterolemia that interacts with the blood clotting system that we were talking about before. So it may not have anything to do with their LDL cholesterol. And so ultimately, my thinking on this, and many others share this thinking, is that looking at the amount of cholesterol is the wrong way to be looking at the problem. We want to be looking at the type of cholesterol that you have, and we want to be looking at inflammation and damage to your blood vessel walls, because those are the things that ultimately lead to heart disease.
Yeah, can we expand the conversation a little bit? Because we obviously, you're specialists in the heart. Have you got any opinions on protein in the kidneys, where many people seem to think that eating protein is going to damage the kidneys?
Yeah, again, the scientific evidence actually shows us opposite. The best study that was done on this showed that high protein diets can actually improve kidney function in people with moderately reduced kidney function. And it's not the protein that's causing damage to the kidneys. It's the same things that we've been talking about that damage the heart. High blood sugar, processed food, oxidation and glycation, all of these things that we've talked about. This is what leads to kidney damage. And I, again, have no reservations recommending a carnivore diet, to people with kidney disease. One thing you do need to be aware of is that the test that we most commonly use to measure kidney function, the blood creatinine level, can be influenced by the amount of protein that you're eating. So, you may need to check an alternative test of kidney function, one called cystatin C, to get a true picture of how your kidney function is. But again, I've had patients with, moderately impaired kidney function that have gone on carnivore diets, eliminated the processed food, and seen improvement in their kidney function. So I have no issues recommending this to patients with kidney issues.
What are your views on stress bringing on heart attacks? Is that a realistic assumption?
Yeah, it certainly is. So stress is a contributor, both indirectly through the inflammation and, the hormonal alterations. Stress can be one of the contributing factors to insulin resistance. But we also know, very well described, that acutely stressful events can bring on heart attacks. And what's interesting about the heart attacks that occur with acutely stressful events is that you don't find blockages in the arteries in a lot of these cases. There's a very well described medical condition. It's called Takotsubo cardiomyopathy, where the patient has a stressful event. They come in, they look like they're having a heart attack. Their heart function is decreased, and you do a cardiac catheterization, but you don't see any blockages in the arteries. The thought is that this has to do with the nervous system regulation, what we call the autonomic nervous system, and the parasympathetic and sympathetic nervous systems, which both innervate the heart directly, and that an imbalance between those two systems that can occur with sudden stress is what leads to this heart dysfunction. So stress is certainly a major factor when it comes to heart disease, both acutely and chronically. And it's one of the kind of pillars of health that I talk to people about. Diet, I think, is most important, but things like stress, sleep, exercise, activity, these all have impacts on our heart health as well.
I think you muted, Steve.
Yeah, I muted myself there. Yeah, Rich, have you got any questions?
No, I just wanted to add something in regards to the vegetable oil and seed oils. We're told to fear the linoleic acid, but it's not so much just the linoleic acid, it's the fact that it's oxidized. So it's the oxidized. It just so happens that linoleic acid in the vast majority is oxidized. But there's, coming back to the phyto-sterols that you touched base on, these vegetable oils are made from phyto-sterols, plant sterols, which mimic human cholesterol, but the body tries to excrete it. The body doesn't want these phyto-sterols, so the body will retain around 1% because it's trying to excrete a toxin. But there's a condition called cytosterolemia, a condition where people will retain a lot more of these phyto-sterols, up to about 4%, and this increases massively your risk of cardiovascular disease. And I'm sure Philip can go into more detail in regards to this. But these oils, these plant sterols, vegetable seed oils, which we are told is meant to negate possible effects of cardiovascular disease and heart attacks. And if that were the case, then why, if the body is retaining more, is it leading to these cardiac events? It's just absolutely counterintuitive to the trail of thinking, isn't it, that these oils will reduce our cholesterol and prevent a cardiac event, when in fact, when we absorb more, we're way more susceptible through this effect of cytosterolemia.
Yeah, and Paul Mason has done a great job in talking about cytosterolemia. But we can also look at some of the randomized controlled studies that were done when vegetable and seed oils were introduced. And most commonly, we can look at the Minnesota coronary experiment, which is probably the best randomized control study we have around vegetable.
That's never going to be repeated, is it? It's never going to be repeated that
no,
way.
it wouldn't even be considered ethical today.
Exactly,
the way they ran that study. And of course, I'm sure many in the audience are familiar that had a negative outcome. The group that was fed vegetable and seed oils had worse all-cause mortality, and there was no significant change in their cardiac-specific events, despite the fact that their LDL cholesterol was lowered. And of course, that data was not published at the time that the study was done because it went against the narrative. and it didn't support the theory that they were trying to push with that. You know, the vegetable and seed oils have never really been shown to be safe for chronic consumption. When they were introduced into the food supply, and again, you know, many will know their history, that they were basically an industrial lubricant, and you know, the companies making them needed something else to do with them, and figured out that if you chemically manipulate them enough, you can make them palatable to human beings to eat. It doesn't kill human beings acutely, you know, in the short term. So they were felt to be safe, and no one really bothered to look at the long-term effects of consuming these. And I think that is what we're starting to see now, is the long-term effects of consuming these vegetable and seed oils.
I think that's a fabulous answer. Karen has asked a question. If a heart rate during sleep suddenly rises from 60, low 60s to over 100, is that stress or cortisol dump? And is it concerning?
You know, that would be something that would concern me. I would want to look into that more. It could be something as simple, you know, not that it's simple, but it could be something like stress and, you know, a sudden cortisol surge for whatever reason. But you do want to look into, is there something else going on there? Is there a issue with the electrical system of the heart that's causing that sudden rapid heart rate? In general, our heart rate should go down when we sleep. And if you're seeing, I would want to know, you know, first of all, how is that being monitored? Realizing that some of these monitors, you know, aren't accurate. But if you're truly getting this on a repeated basis, that would certainly be something that you should talk to a physician about.
That's fabulous. One more question from the viewers. This might not be anything that you know about. My wife's sister has protein S deficiency. Do you have any experience with something like this being helped with dietary change like carnivore, or is this something unrelated?
Yeah, so protein S deficiency is a genetic condition. Protein S is related to the blood clotting system. So this is a condition that can cause someone to be more prone to blood clots. I don't know of any direct effects of diet on protein S deficiency. It is a genetic issue. But again, what I would say, and this is more broadly applied, but you know, probably applicable to protein S, is inflammation seems to be the underlying issue with a lot of these, you know, blood clotting disorders. So anything you can do to lower inflammation, I think, is going to be beneficial. So again, it may not directly affect, you know, your protein S levels, but by lowering inflammation in the body, you're going to make yourself less prone to bleeding, less prone to blood clotting. And so I could see that there could be some benefit to dietary changes to help with this condition. It's not going to cure it, but it may help with the management of it.
Yeah, one of the things that occasionally, I mean, I've been online coaching or doing carnivore coaching for 4 years. It comes up every so often. People say, since I've started the diet, when I go to bed and I lie down, it feels like my heart, I can feel my heartbeat more. Any reasons why that might be happening?
You know, something I've observed and heard as well. My thinking on it is that we're just becoming more attuned to our bodies, more aware of our bodies. When we eliminate the sort of fog and the noise that comes from, you know, high blood sugar and erratic blood sugar levels, it just seems that, you know, people who are eating clean, whole food diets are just more aware of what's going on in their bodies. And that can be one of the things that we start to notice more is our heart rate. You know, there are also some you could start to theorize, better blood flow coming up to your, to your head, to your brain, through the arteries in the neck, which is where one of the key blood pressure sensors in our body is. If you're healing that endothelial damage, you're getting better blood flow. Again, maybe that's part of the reason as well. But I think in general, my perception of it is just that people are better able to perceive lots of things that are going on in their bodies when they eliminate processed food.
Excellent. So, Philip, are you still with Revero? Do you have any ties with Revero, or are you completely separate?
Yeah, so I don't have any direct ties. I talk to Sean Baker often, and I consider him a colleague and a friend. And but I don't have any direct ties to Revero.
Oh, right. Okay. Because that's where I first met you, when it was
Yeah.
MeatRx.
Yeah, early on, as I mentioned, Sean was really my introduction to the carnivore diet, and I helped him early on getting together sort of the research section of the MeatRx website. Did some work with him on that, and like I said, still a good colleague and friend, but no formal relationship anymore.
So I remember asking you whether your colleagues thought you were a bit mad doing carnivore, whether there was a bit of pushback, and I seem to remember there was. Most of them weren't that interested in eating meat. Has that changed? Have you seen maybe a shift towards keto a bit or anything?
Yeah, so I think low carbohydrate diets in general are becoming more accepted. Still, certainly not the mainstream, not, I think, recommended nearly as much as they should be. But I think more and more physicians are realizing the benefits of these. And when we look at things like diabetes reversal, we now have pretty good published data on that. So I think that's becoming more widely accepted. Carnivore, I think, is still seen as an extreme of that, although I would argue that it really isn't. I view carnivore as, first of all, the best elimination diet we can do, as we're trying to help patients figure out, what's causing some of their issues. And then I really just view it as a more simplistic form of, ketogenic and low carb diets. Because rather than counting and tracking and, do I eat this? Do I not eat this? I think carnivore is just pretty simple as a concept. Eat meat, be happy kind of approach. And so that's why I find myself recommending it more and more. Patients, are open to the idea. But I do still spend a lot of my time dispelling the myths around red meat and heart health. That's the big one that, I have to work with patients on. But, intuitively they get it. They understand that, red meat is not what caused their heart problems. And that we as human beings have been eating red meat for our entire evolutionary history. And it never was the red meat that was causing the issues that we see in modern times.
Yeah, I think I've one more question is just snuck in if you've got time, which is from Zoe. Does autophagy heal the heart in any way?
Yeah, I think, autophagy is a great healing process for our bodies in general, and there's no reason to think that wouldn't apply to the heart. One of the other concepts that I've, start to recognize as strange is that we think that, something like LDL cholesterol or whatever it is somehow going to be uniquely damaging to the heart, even though it doesn't have damage to the rest of the body. Again, it doesn't make sense that our bodies would evolve in such a way that, something like autophagy, let's say, that's beneficial to everything else would not be beneficial to the heart. You know, we didn't really even touch on, but kind of related to autophagy, is ketosis and ketones. And it's interesting that ketones do seem to be uniquely beneficial to the heart. The heart is one of the organs that can best utilize ketones as an energy source. And so, you know, ketosis may have some unique benefits to the heart above and beyond its benefits elsewhere in the body.
So, Dr. Philip, that was brilliant. And I'm really surprised Rich there has not dived in with another question. Do you want to grab him? I mean, this is a heart expert, Rich. You must have a question you want to.
Yeah, look, I'm just yeah, I'm here taking it all in. This is fantastic. Yeah, it's brilliant. I mean, coming back to one of the points you made in regards to the Minnesota coronary artery experiment, and you know, that was carried out between 68 and 73, but these results weren't released until 2016, as you rightly say. The results did not fall into the narrative that they wanted it to, so they hid those results. And for the people who were unfamiliar with that, the study included 9,423 patients. They were split into two groups. One group was fed saturated fat, the other group was fed vegetable oils, in an attempt to show that the vegetable oils would lower blood serum cholesterol, and it did. The group consuming the vegetable oils lowered the cholesterol, but that group had a higher mortality rate. So it basically showed the opposite to what they were trying to prove, and this is why you know, this evidence was hidden. And a similar study, I think, took place in Australia. The name of that one,
the Sydney diet.
By the way, so say it nice and easy when you know. I should have guessed with the Sydney, Minnesota. But yeah, it happens, isn't it? And it's border. Well, it is criminal in my opinion, because how many lives have been lost through this common misconception that cholesterol is detrimental to our health, when in fact it is in fact the opposite. It's imperative for life. No, but I've thoroughly enjoyed this. This is yeah, it's been fantastic. Very much appreciated.
So, Philip, thank you so much for turning up and giving us a bit of your time and going over your time a little bit, which is my fault because I wanted to make the most while you were here. And we would be much more enthusiastic if we hadn't been standing here for 21 hours.
Well, I greatly admire, greatly admire what you guys are doing, and the fact that you're 21 hours into it, you know, speaks to the power of carnivore as well. The endless energy, I think, is one of the benefits I've certainly gained from it. But I thank you for having me as part of this. It's been an honor, and keep up the great work.